Hi, I'm Dr. Eric Westman, and this is the Keto Made Simple podcast.
Hi, everyone. Dr. Eric Westman here, and welcome to my channel where I traditionally review and debunk nutritional misinformation online. But occasionally I get to interview the movers and shakers in the carnivore, keto, low carb, the name has changed through the years, in that community. And it's my great pleasure to actually meet for the first time and talk to Dr. Anthony Chaffee. Did I pronounce that right?
Yes, yeah. Thank you. Yeah, that's correct, and it's a pleasure to meet you as well. I've been looking forward to this.
Do you go by Tony or Anthony or both or?
Oh, I don't mind either, but yeah, usually Anthony, but yeah, exactly, yeah, or Shirley. Okay, yeah.
Well, so tell me a little about yourself. Imagine we're talking to my patients. They come to me for diabetes reversal, obesity reversal, now all sorts of disease reversals that I couldn't have predicted 25 years ago when two of my patients used the Atkins diet to lose weight. And I thought, well, this would be easy. We'll publish a few papers and there will be no more obesity left. Well, that was 25 years ago. So very curious, where are you from? The training you got, how did you come to where you are now?
Yeah, absolutely. So I grew up in Southern California and Seattle. So I went to high school and then university in Seattle. I did my undergraduate degree at the University of Washington, and then transferred for my last year. Actually finished up in Arizona, at the University of Arizona, and then I played professional rugby, at the highest levels I could, and then professional after college. So all the highest levels in the U.S. Super League in America, Premiership in Canada, and all this representative sides. I was all American. Then I ended up going overseas to play professionally in England. And I really liked it over there. I really enjoyed living abroad. My grandfather had been a Rhodes Scholar at Oxford, did his PhD there, and had all these great stories of doing, grad school overseas. And I thought it would be sort of fun to do the same thing. And so I ended up going to medical school at the Royal College of Surgeons in Ireland, and was there for 4 years of medical school, and then 2 years as a doctor. After that, my parents were having some health issues. I had been focusing on neurosurgery, so I was going to continue on in neurosurgery. I had very close ties to the neurosurgical department there, and really liked the department. And but my parents got a bit unwell, and I wanted to come back and help them. So I was back in Seattle helping my folks. And when that settled down, I heard about a sort of a humanitarian crisis in Bangladesh with the Rohingya refugees who were escaping like an actual genocide over from Burma in 2017. And so I went over there in 2017, stayed till early 2018, and was helping out in the refugee camps there. And then when I came back, I was sort of looking, okay, where do I want to go and finish up my residency? Do I go back to Europe? Do I come back to America? I actually did my sub-internship in plastic reconstructive surgery at Duke. Actually, I absolutely loved it there. So I was thinking, okay, well, maybe you look around here. And I ended up deciding to come to Australia probably because of the rugby connection. I had sort of been all over the world with rugby to New Zealand, South Africa, Europe, and I'd never quite made it to Australia. And I had some friends that I'd played rugby with professionally in England that were now living down here, and they really liked it. And then some doctors that I knew from medical school, they were down here as well. And so all else being equal, I just decided to come and check it out. And I got back into neurosurgery here, working as a neurosurgical registrar, which would be equivalent to a resident in America, and did that for past sort of, so about 4 years. And then I have subsequently transitioned into private practice in sort of the metabolic health space, applying diet, lifestyle, nutrition interventions, as well as allopathic medicine to help my patients, simply because
a lot of, so for those who don't know about medical training and all, the neurosurgery it's got to be the most difficult, arduous, longest even in the surgical specialties, the neurosurgery is very, very much not only a pyramid. Not everyone gets to the top, but the joke was, I mean, you're never on call. I mean, you're always on call. I'm sorry. And so when I started hearing, well, you're a neurosurgery resident and you're doing this practice, I mean, come on, this. Although I have to say, the neurosurgeons that I've met are superhuman type folks, who can stay up all night for a week and still go in and do a craniotomy. I mean, and then it kind of fit that, well, of course, you'd be playing rugby and being at the top of the game there. And so that makes a lot of sense. And so you transitioned to now metabolic practice. I wondered a couple things. Did your rugby and fitness experience, athletic experience, get you into this metabolic health, or was that a distraction? I mean, it depends on what era, I suppose.
I think that it certainly was complementary, because I was, always studying, biology and all the different sort of prerequisites. I was interested in biology and chemistry and human physiology, just because since I was a kid, I'd wanted to be a doctor. And so that always fascinated me. And I knew, I mean, my parents instilled on us the importance of nutrition for health. And so that was always something that was in the back of my head. And I studied nutrition because I thought, okay, well, how do we make people as healthy as possible? Okay, this is going to be part of that. Nutrition is obviously going to be a major component of that. And then you learn medicine to treat all the things that, nutrition, lifestyle, and those sorts of interventions can't help with. And when things go really wrong and you actually need help, I mean, that's what medicine is in its sort of raw form. And so I studied, supposed to be, definitely. And so I was always interested in nutrition. I would take nutrition classes, but what really sparked this for me was sort of a funny story, and sort of the progenitor of some of the videos that I've named with sort of shocking titles. I studied botany, I studied biology. I understood that plants have toxins and defend themselves in this chemical nature, that we've identified, cataloged, quantified, and named about 1 million different defensive chemicals that plants use to stop predation, and that animals and plants are in an evolutionary arms race, plants becoming more and more toxic, so less and less animals can eat them, so they can survive and thrive, and animals becoming more and more adapted to specific poisons in specific plants, so they can eat that plant and survive and thrive. And so that's their evolutionary niche. And so I understood that, but then you go home, your vegetables, it's just this sort of this separation. It's just like nature and humanity, just these two separate things. And of course, they're one. But I had a professor of cancer biology when I was at the University of Washington who really impressed this upon us, how these toxins were not just in the plants in the woods, and that's why you couldn't eat those. It was in all plants, even in the fruits and vegetables that we ate. And this was specifically at cancer biology class. We used to be talking about carcinogens. And he said that there was 136 known carcinogens identified in Brussels sprouts back in 2000 when I took this class, and over 100 in mushrooms, and 60 or 80 in broccoli and cabbage and celery and cucumber and all the produce items that we would normally meet. And we were very, very shocked by this. And he went into further research about this, about how harmful this stuff was, and how it was many times, hundreds of times more likely to cause cancer in lab studies than various pesticides that were used on them. And we thought that he must be joking. We sort of were looking around wildly, looking for like a TA in the back to be snickering or something like that. And there wasn't. And we sort of realized it at a certain point that, okay, this guy is serious. And we all sort of settled down. And I remember thinking about, but vegetables are still good for you though, right? I mean, overall. And he gave us a bit of a funny look, and he just said, I don't eat salad. I don't eat vegetables. I don't let my kids eat vegetables. Plants are trying to kill you. Okay, that's sold. And I went to the grocery store after that, and I just looked for anything that didn't have a plant. And I realized that just everything had these as ingredients, or were largely, predominantly, or solely made from plants, grains, etc. And I just came across eggs and meat, and I just said, okay, that's what I'm going to eat. And so my entire litmus test for what I was going to eat for the next 5 years was, does it have a plant? No, fine. Or yes, then no. And I felt absolutely amazing. And I was playing better than I ever had in my entire life. I was already an All-American. This just launched me to new heights. And I felt absolutely incredible. I mean, I really just felt like I was on a different level than the other people around me. And then I was in England playing professionally, and I sort of slipped off because some of the meat that I was buying had some crumbs on it. And I thought, well, you know, dose makes the poison. Maybe it's not that big of a deal. Same argument that people throw at me now that, you know, yeah, plants have toxins, but dose makes the poison. Sure, dose does make the poison, but it's actually a lot smaller than we think. And I absolutely noticed a huge drop off in my performance and how I felt. I started getting soreness, aches, little niggling injuries that were never there before. And I didn't understand what was going on. I thought I needed surgery or something because I just had a groin pull. And I was like, what is going on? And that opened the door to sort of let other foods in. I always ate a very clean diet. I never ate a processed food diet. The argument is that people on a carnivore diet improve because they're just getting away from junk food. But I never ate junk food. I ate a very clean, omnivorous diet with lean meats and fruits and vegetables and really no sugar. I was never really a big bread person and sugar person. So, I mean, I would sort of naturally swing to a more ketogenic diet simply out of preference. I just didn't eat many carbs out of just habit. And it was just, but then adding in a bit more vegetables, I would basically still eat lean meats and salads because you're supposed to eat salads. And I did not feel the same. I sort of chalked it up to age, but it doesn't make, that doesn't make sense because when I was 25, I felt like a superhero. When I was 25 and a half, I did not. And I couldn't quite figure out what was going on, but there was a clear line in how I felt. And it was after a few weeks, I was like, wait, what's going on? What's happening? And it took me a long time to figure that out. It took another sort of 12, 13 years back, actually, right when I got back from Bangladesh in early sort of 2018, when I came across information that really convinced me that, well, no, humans actually biologically are carnivores. We've been apex predators for millions of years. Apex predators by definition are carnivores. We have very strong evidence that people were thriving in the Arctic circles during the ice ages. We had people traveling by foot across the land bridge from Asia to North America in the last ice age. So this is a time when the middle of America and Seattle was under a mile-high block of ice. So what is there exactly to eat in those conditions besides meat? And so that's just sort of clicked in as, okay, actually that's what I was doing. Biologically, humans are carnivores. We're most adapted to meat. There's this biological law of adaptation where the thing you've been exposed to the longest is what you are used to, and your species is largely not designed to eat, but better equipped to eat. And that's what I was doing. I was eating as a carnivore. I was eating to our biological design, and I felt better than I ever had. And I said, right, I knew it. I knew plants were trying to kill me, get rid of these stupid things. And I stopped eating that. I was already ketogenic at that time. I had again gravitated away from carbohydrates just because I felt the inflammation. My back hurt whenever I ate carbs. It was very easy and very simple. Whenever I had a spring roll or some sourdough bites, my back would hurt for several days. And so I don't like that. And so I just naturally gravitated away, and I was just eating vegetables and lean meat and not that much meat and a lot of vegetables because that's what you're supposed to do. And I was trying to lean up and get healthy so I could get back to playing rugby. And as soon as I dropped the vegetables and started eating a lot more meat and fatty meat, because I had come across, the data on how that is not actually going to be harmful to you and is a very essential nutrient, I felt massively better. I lost quite a significant amount of weight in the first few weeks. I think largely to do with inflammation, but there's some fat there. And then I started really honing down my body composition and shedding a lot of fat and putting on a lot of muscle because I was working out quite heavily. And after about 2 weeks, I felt so good. I said, right, it's time to go back and play rugby. And at 38 years old, I went back and started playing professional rugby. And I felt so good. I was back. I felt like I was 22 again. I just felt
Did you run across, or was the rugby world you were in into this? Because Peter Bruckner, coach in Australia, Prof. Timothy Noakes, Tim Noakes in South Africa. I go to those meetings, all they talk about is rugby. And I'm sorry, I'm a typical American. I call football, and it's soccer, and I don't know the rugby rules. Sorry, it's
no, I'm with you there. Yeah.
had it penetrated into the rugby players that you played with?
Well, in Seattle, they saw how well I was doing and my performance and my fitness and how my fitness just really just took off. And in fact, we went I went to practice sort of 2 weeks after I did this, and I felt amazing. And I was, even though I was very much out of shape, I hadn't played a full season in 3 years, I was able to be at just a dead sprint and perform at the level that everybody else was at, even though it was mid-season and they were all in pretty good shape. 2 weeks later, we did a fitness test called the modified bleep test. And so I only had 4 practices under my belt, but because of my diet and because of how good I felt, I was able to come in sort of the top 5 out of about 90 players. And so all my friends who I grew up playing with were now the coaches and managers, and some still playing. They came to me and said, wow, yeah, you've been really staying on it and staying in shape, haven't you? As that, absolutely not. I'm completely out of shape. This is 100% diet. And they started getting really interested in that. So a lot of the players there got interested in it. They hadn't known about it before that, but a lot of the guys started doing that, feeling much better, much stronger. We ended up winning the Major League Rugby that year. Was actually the first year that competition was enacted. Now, not everybody did that, but there were a few people that had done that and had significant improvements to their performance. Here in Australia, absolutely, there are a lot of rugby players that will do this at both the local, semi-pro, and professional levels. And in fact, Peter Bruckner, I know works with several sports teams around here. And then our mutual friend, Dr. Paul Mason, is another sports medicine doctor down here. And he works with quite a lot of top athletes and even entire teams. And in order getting them more ketogenic carnivore, not just ketogenic, but oftentimes full carnivore, and they're having massive improvements. And some of these are actually have been in the national newspapers and things like that, talking about their transformation on a ketogenic carnivore diet. But we're seeing massive improvements in people's health. And my reawakening to this and my ability to go back and play at a high level and feel so good at it, I sort of started thinking about this from a medical perspective and started thinking like, well, we're the type of animal that we are if we are carnivores and we're just not living as such, then we could be getting sick as a result of that. Just why they have signs at the zoo that say don't feed the animals. They get very sick if they eat something outside of their normal diet. We're animals. And so if we have an evolved diet, which why wouldn't we? We didn't come here from space. The same biological laws should apply to us as they do to other forms of life on Earth. That if we eat outside of our biological design, we should see similar patterns. And it's interesting because the types of diseases that zoo animals and domesticated pets get when they're fed the wrong thing are diabetes, obesity, cancers, autoimmunity, feline lupus. These sorts of things. So why is it that we recognize this from a veterinary perspective, that when fed an inappropriate diet, these animals will get so-called human diseases? But when humans get those human diseases, that's just genetic. You can't help that.
Well, I have to say I'm a clinical trialist. I got into this doing first uncontrolled but prospective studies, and then clinical trials, and the argument of what we ate over time, to me that's a bit academic, a bit it's definitely not appreciated by my colleagues in academia, the doctors. They say, oh, come on, give me the study, give me the randomized trial. But it occurred to me, like you, that it wasn't the teeth, it wasn't the other arguments that the vegetarians make, which, it'd be great to have a side-by-side debunking of the vegetarian arguments. It was the intestines that got me. So, as an internist, I know a little bit about every organ when it fails, and then became an obesity medicine doctor. So most people come to me for diabetes reversal, obesity reversal, metabolic issues. But I'm really intrigued or was persuaded by two things. One, the internal anatomy of a human. I mean, there was a book called Eat Bacon, Don't Jog. And it was this little thing. And in there, it was like match the human intestines to the animal. And it wasn't the gorilla. And we see doctors and other vegetarian folks think, see, that's closest to us ancestrally. And Steve Finney, one of my teachers, said, yeah, but there was a couple million years between the ancestors. So anyway, things could change in a million years. So the internal intestines of a human are basically like a dog, or a cat, or a pure carnivore. Then appendix we have is the vestigial cecum that the gorilla has to be able to digest. So anyway, it kind of just irritates me when someone who should know better talks about us being gorillas and just eat plants. Come on. So the internal anatomy persuaded me, and then I had to say the face validity of plants can't run away. That, how do they defend themselves? So it was like the science, and then the kind of, well, I'm the kind of guy who, is it going to rain today? I look at the weather prediction, and then I look out the window, like, I don't just rely on predictions. And I think that's what a clinical practice kind of forces you to do. You learn things, but then you see the practical reality. Oh, the other thing that was in this book, which we're going to learn is not really yours. In here, they did include, so it was in one of your lectures, the Barry Groves idea. He did a video, Homo Carnivorous, and I pulled that up.
Man, great video.
Funny. Yeah. And basically all mammals absorb a high-fat diet. And it's just a brilliant, quick rundown on not just the internal anatomy, but actually the physiology of what happens. And, I'm not an animal husbandry, botany kind of guy. So when I learned that it was the bacteria inside the animal of the ruminant animal that eats grass, actually turning it into fat, and then the bacteria being absorbed as a major protein source. I mean, we got none of this kind of comparative physiology and all. So anyway, I still kind of liked this as a summary, but tell me about this book. 'Cause I got it on Amazon, and did you write it?
Yeah. Yeah. So that unfortunately that was taken from some transcripts from my videos. So the information there is collected from things that I've put together. Unfortunately, it was taken without my permission, and so used unfortunately without my knowledge. They say that the 25% of it or whatever goes to charity for Professor Thomas Seyfried's cancer research. I've spoken to Professor Seyfried. Unfortunately, he has not received anything from these people. So it's a bit of a scam, unfortunately. The information is my own. And so hopefully that is still helpful to people. But
well, then I wondered, who your editor was. Cause I mean, so that actually it's reassuring to me that someone with your credential and background and all that didn't come up with this, because I was a little bit it tarnished what I had learned from you, and so I think that's important to know, that there are scams, there are people, they've done that with my books as well, and kind of the telltale sign is there's no frontispiece of a publisher and yet the information still is really good.
Yeah, and like you say, I mean, it does sort of tarnish my reputation, because it is being portrayed as my book, but it's just a transcript that's being put out there. So it's actually not. It doesn't read like a book, and so it's sort of a very poorly written book. It has maybe good information in there, but it's a very poorly written book. So I see people in the reviews saying like, I was really disappointed with this. It looks like he just really phoned this one in, and unfortunately, Yeah. The guy did phone it in, and yeah, it doesn't look that good. So yeah, so we've tried to get.
Do you have intentions to have a book or other in your or so anyway? So I think like before we get to what you're doing, sorry, I wanted to just kind of close the history of what we've eaten and all. I think is interesting, but it's not what we should dwell on. It's what can we do going forward. In fact, we might be able to come up with food and a lifestyle that's even better than we've had before. I mean, I grew up in the age of technology and science, and I would never dream that I could take a picture on my phone or with my phone. And, the internet is an amazing thing. So, but I want the health of a carnivore. And like you said, they really don't get cancer, diabetes out in there, but so to me, I don't want the health of herbivores and many omnivores because the disease they cause. At the same time, I'm not totally convinced that everyone needs a carnivore diet but so switching gears, carnivore has some unbelievable stories of transformation and resolution of medical problems that the medical world couldn't fix. And I see that in my practice now. And so I kind of passively allow, well, if you don't want those greens and especially if they hurt or if someone once told me they finally figured out it was the plants that made their stomach hurt, but they never could figure it out with all the different foods. So tell me about now what you've learned about carnivore, what it can do, and I have a few kind of tough questions we need to wrestle with before it can be a policy, I think. So, what have you seen? What do you teach? What are you doing now?
Well, I certainly have seen quite a lot of benefits, and I think there's obviously a gradient. You can get so much benefit from ketogenic diets in general, and I try to instill that in my patients because when I really sort of had this aha moment that, okay, well, this could actually have a huge impact, and this could be a big part of why everybody is so sick and getting this rise in chronic diseases because we're eating the wrong things. I started really digging into the research, and thankfully, I still had some time off before I went down to Australia, and I spent probably 8-10 hours a day just reading studies and just trying to, and I found this entire world of literature and knowledge that was not spoon-fed to me in medical school or beyond, and it was amazing, and it was absolutely incredible. I even tried to say like, okay, well, everything's coming up ACEs for eating meat. What am I missing? There's all these vegan doctors and people saying that meat's bad. What are they saying that I'm not getting here? And so I went to their resources. I went to their websites. I went and asked them, see what was going on. And everything was sort of based on old, outdated information like cholesterol causes heart disease, or meat causes cancer, or these sorts of things, or outlandish lies that humans have always been herbivores. And it's like, okay, no, we have not. But it just didn't show any real merit to me. And so I said, okay, because I didn't want to be a victim of confirmation bias. So I went to the most compelling people arguing for a vegan diet, and I did not find that very well suited. And so when I started applying this to my patient population, like you said, I saw things reverse that even now 99% of humanity would think is irreversible. You just can't reverse these things. But I was seeing it every day, and I really love that that ketogenic diets and carnivore diets are really being more accepted for treating things like diabetes, because if you have diabetes, you likely have multiple other things as well. And so doctors are going to start seeing, okay, well, this is going to reverse diabetes. That's amazing. But then they're going to start seeing, hey, actually, this person has Crohn's, actually went into remission at the same time. And, now they're on less blood pressure medication as well. And all these other sorts of things are improving. And then they're going to start putting tubes. And what, sorry?
The joint pains.
And absolutely. Yeah, joint pain is an amazing one. I mean, I know a number of orthopedic surgeons that have come to this specifically because putting their patients on this diet, they no longer need joint replacements. Even though they have severe arthritis, they don't have the pain anymore and they can function. which is amazing. And chronic pain doctors I've spoken to that use ketogenic carnivore approaches because it radically improves the pain syndromes like fibromyalgia or even radiculopathies. And in neurosurgery, we have so many patients that would have neurological dysfunction due to disc impingement or some sort of canal stenosis, and you could surgically repair this or reverse the impingement, but sometimes the nerve was permanently damaged and it wouldn't help their pain, unfortunately. So they'd be absolutely racked with pain and it wouldn't really get better. And then I would suggest to them these sorts of dietary approaches and specifically being ketogenic, because as you know, there are thousands of very high quality studies showing the the benefits of ketogenic diets in human health. And relaying that to people, discussing inflammation and how, ketogenic diets and carnivore diets in particular, which of course is a ketogenic diet, can help reduce inflammation and improve pain, and seeing massive improvements in their pain. People that have been on opiates for 10 years, in very short order, of a couple months, come off their very serious medications. So
an example in my career is I've only been asked to speak at other health medical health conferences, like other subspecialties, a couple times, and one of them was the American Society of Interventional Pain Practitioners, and they came up to me and said, "We're using keto for pain." But that's where I learned about it. There were about 10 doctors who came up. It was a national meeting. I was the keynote speaker. And so the pain relief signal it's not just, a few doctors. There are a lot of people who also observe that. And, but that's kind of the grassroots dilemma, right? We see all of these changes and all, but can we really say it's going to work, 100% of the time, 50%? Or what's your gestalt of using an approach like mine, but less vegetables? If someone does it, is it 100% effective?
Well, I mean, it depends on the condition. And, like you said, does everybody need
diabetes reversal or obesity?
Oh, yeah. Well, I mean, I have yet to see somebody not be able to reverse their diabetes.
No.
Let's put it that way.
You can say,
Yeah.
yes, it's 100% effective.
From what I've seen anyway, when people do it 100%, I have seen on 100% of people reverse their diabetes, and probably near 100% for autoimmunity as well. Autoimmunity is an amazing one for the carnivore diet because you're eliminating out everything that could possibly have a problem. Now, maybe you can add certain things back in that won't flare up, but it's hard to sort of see which ones those are. And some people cannot have anything besides just meat and water, or even just ruminant meat and water. And some people, very few, but some, can't even have anything except grass-fed, grass-finished ruminant meat and water because their autoimmunity is so sensitive. And so I've seen everybody improve. Yeah. So maybe not 100%, unless maybe they go very, very strict grass-fed finished and things like that, but significant improvements, able to come off medications, etc., in very short order. I have had MS patients, multiple sclerosis, who have had very severe degenerative conditions, who have not only reversed their symptoms, but on MRI, reduced their lesion burden by over 50%. And that's not something that's really well described in the literature as being able to happen. And so we're actually putting together a case series of MS patients who have reversed their condition. Congestive heart failure. I've had patients with under 15% ejection fraction who in a matter of months came back to completely normal. I've even seen ischemic congestive heart failure patients who had previous MI and scarring on the heart that really shouldn't get better, but the rest of the heart must have picked up the slack. So I actually spoke to another physician who had a patient in this category, had a 22% ejection fraction post MI, years after an MI, went onto a ketogenic carnivore diet and is now up to 33% after just a couple of months. So there's already an improvement there. If not back to normal, at least it's better. And so I do see a dramatic improvement. I do think that some of these diseases, like diabetes, like most autoimmune conditions, are caused by eating the wrong thing. And so if you remove those things and you start eating the right thing, I think it's a combination. So, and this is actually the premise of my book, is arguing that the majority of the so-called chronic diseases that we're treating nowadays are not diseases per se, but toxicities and malnutrition. Yeah, exactly.
Environmental exposures.
Exactly. Or some sort of malnutrition. You're not getting the right nutrients in a certain way. And so that's causing problems as well. And so I make that argument.
I wonder if through the years you met Ted Naiman in Seattle. He is a keto doctor there, family medicines, worked with diet doctor. And we were on a podcast once and I said, people come to me in wheelchairs, they lose weight. He said, oh yeah. Competitive guy he is. He said, oh yeah, I treated someone who came to me on a gurney. He was paraplegic and he lost weight. So, and so that's gaming. I mean, I've had people come and reverse the diabetes, obesity, and basically I've said, say now, here's your food prescription, but there are some plants on it. But I say, if you follow it, have no doubt that it'll work. So I'm in that space where just a lot of people don't want to do it, or they're carb addicted, and there's a potential strength to just keeping it to a carnivore simplicity, doing one thing that takes away. It might work better. I mean, I'd like to see head to head. I guess I teach a ketovore, 2 cups leafy greens, 1 cup of non-starchy vegetable. Take the worst case patients. And that's a good space to be in, where other doctors don't want to deal with these people. They're just so complicated, and they don't follow my like, well, just have them eat meat, and actually amazing things can happen. But so I see carnivore actually scientifically, as you said, it's a subtype of a low carb keto kind of diet, although there's some people are in ketosis, others aren't. I think most people are, or they're shifting to keto burning so well they don't have elevated ketones. And of course, heart failure gets better if you take a drug that increases the ketones. That's the SGLT2 inhibitor story. So the medical mainstream is learning about keto diets through a drug side effect. I mean, it almost reminds me of the way the erectile dysfunction medicines were discovered. It was a side effect of a drug used for something else. So, but at least locally, the cardiology researchers don't know anything about a keto diet. So they're giving exogenous ketones to help with heart failure, which just, as a heads up, they might be talking about a drug benefit, but the side effect of the drug is that it can give you Thorny's gangrene and ketoacidosis. So, and carnivore shouldn't give you ketoacidosis, unless you have diabetes. Well, so autoimmunity, I think this is a space, and I've seen people do keto for a while. They're just not totally fixed autoimmune wise, and then they go to a carnivore. So you drop off that last cup of vegetables, and they improve, which kind of leads to your thesis, or the way you're summarizing it, that just a little bit of poison. On the other hand, some people argue that if you stay away from it, you get more sensitive to it. So now let's get into the thorny aspects of carnivore, which is, the more you restrict, the more you get sensitive to those things. And so some people come back and say, well, I'm doing great, but if I have just a little bit, I don't feel right of something, when they had that something before, and either they were numb to it. So can you adapt, and how can people eat carbs and vegetables and be healthy? And so what are your thoughts about that?
Well, as far as the sensitivity goes, I this is something that you do see. I think it's twofold. One, you're seeing this contrast in how you feel, and you feel a lot better. And then you add in something else that may be deleterious to your health, and you see this contrast and you say, I don't like that. And now it's noticeable. But I think that there is a sensitization process, just like you would be more sensitized to alcohol if you abstain from alcohol for a long period of time. You build up a tolerance. So you're going to build up tolerances towards any sort of drug or toxin or any sort of, I mean, and the thing is, we do know that these plant chemicals are toxins because our body tries to detoxify them. They try to clear them from our body. We don't use them for any biological purposes. In fact, our body ramps up our biological machinery to get rid of them and break them down and get them out. And we can build up a tolerance towards this, and we can get better able to do that. And so when you subject yourself to these sorts of things, maybe it's not as bad as it would have been if you weren't as tolerant. Now you go away from that, and your body is very efficient, and it doesn't need to have these defenses all ready to go. And so you lose your tolerance. Just like if you didn't drink alcohol for 6 months and you tried to drink the same amount of alcohol, it's going to hit you a lot harder. And so I think that's twofold. A, you're going to be seeing this contrast. It is going to hit you a bit harder, and I think that's one of the reasons that so many people are very fixated on doing this long term. I mean, we talk about having a need to do it. It depends on what your definition of need is. I mean, there's some people that if they want to stay off medications and be healthy, they probably do need to. Very, very sensitive autoimmune patients, etc. I don't need to from a medical definition. I wasn't sick before that, if you could say that, but I still feel a lot better. And I feel so much better. My body performs so much better. My brain works so much better. And I can do 130 hours a week in the neurosurgical department and do interviews at 1 o'clock in the morning, which is what I was doing when I first started my channel, because of my diet, because of how well my body works, because of what I'm eating. And going back and eating something else, I feel so strongly worse. Not that I get sick, I don't get a rash, I don't have to go to the hospital, but I feel worse, and my body doesn't work the way I know it can. And so I have no interest in going back to that. So you do have a sensitivity to it because you just lose that tolerance. And I think that's a good thing. I mean, I don't think we need to drink alcohol every day just to maintain that tolerance, just in case we decide to binge one weekend. The same thing, I don't think we necessarily need to subject ourselves to different other toxins of other descriptions in order to maintain that, just in case we go and have a big salad.
Well, you're making me think, which is great. Yeah. There's so much hullabaloo about the ultra-processed food and all the toxins, and there are just as many in the vegetables.
Absolutely.
Holy cow. Well, so the other thing, when I came to this, again, I didn't have much nutrition training, but you had more than I, and I had to learn on my own. It occurred to me that the absence of foods was how, in many cases, this works. Absence of toxins. The gluten is eliminated. And I had someone who had, I think, gluten enteropathy for 7 years that was undiagnosed.
Oh, wow.
Even had scopes up and down, but they never looked at the jejunum and looked at the villi. And so some of these diseases are hard to diagnose. And yet in a week of carnivore, she was feeling better and basically absorbing iron, and nobody ever figured it out. So I came to this thinking, well, okay, it's because they're not eating junk food. It's because they're not eating gluten. It's because they're not having the simple sugars. It's because, but now we have, is there extra benefit of ketosis, right? Ketones themselves can actually have positive benefits. And now you're kind of expanding my mind by saying, well, maybe even a little bit of vegetable matter is a toxin and it should be eliminated as well. So the carnivore would be the ultimate elimination diet, wouldn't it?
Yeah, absolutely. And I'm not the first person to argue this. I don't know if you've come across Dr. J.H. Salisbury, for whom the Salisbury steak was named. So great book. He wrote it.
Salisbury steak, of course.
Salisbury steak, yeah. So that's named. I always thought it was a place name named after like Salisbury, England, but it's actually named after Dr. J.H. Salisbury, who was a New York doctor in the 1800s during the Civil War era. And he did a 30-year research project into optimal nutrition for human beings. And he tested all sorts of different ways of eating. He lived with the Native Americans in the Great Plains before the bison were wiped out, and found that these people were extremely long-lived and didn't have any of these sort of so-called Western diseases. They predominantly just ate meat, and this was long before the processed food companies started making a name for themselves or even existing. And before seed oils and before Crisco and before sugar became a rampant commodity. But he found that people that were eating more grains and plants and less meat were getting diseases other people simply weren't. They were getting autoimmunity. They were more susceptible to tuberculosis. They were getting gout. And he found that he could cure them by putting them on a pure beef and water diet. And the Salisbury steak was grinding that meat in such a way that it filtered out the gristle and made it much more easily digestible. So you're just getting the soft muscle body and just getting the soft fat, or even adding butter back to that, because a lot of fat would get pulled off with the gristle. That was a Salisbury steak, and that was specifically for his patients that had extremely poor digestion. So you're thinking people with Crohn's and ulcerative colitis 100 years before you had any sort of treatments for this. And he said that it was very important that you had to get that gristle out for these patients, because they had such horrible digestion that you had to completely rest the bowel. And by getting out the gristle, you would absorb essentially 100% of the meat that you're eating. And this would completely rest the bowel, and you could actually reverse Crohn's, ulcerative colitis, but also rheumatoid arthritis. And he wrote a book called The Relation of Alimentation and Disease. So alimentation being our digestion. And so the relationship between what we eat and the diseases we get, which is the exact premise of the book that I'm writing, which is just the 2024 version. But this has already been discussed. And then you have people like Vilhjalmur Stefansson, who wrote The Fat of the Land, who lived with the Inuit for 15 years and discovered a meat diet there. Weston A. Price, who looked at early primitive pre-agricultural populations and that transition to a post-agricultural way of eating, and the fall in their dental arches and teeth and jaw development. Even more recently, there was a Dr. Walter Vogelin. I think he was a gastroenterologist in the 1970s. I think it's 1975. He wrote something called the Stone Age diet. And he said, look, we're carnivores. Here's the evidence for this. And these diseases that we're treating now are largely due to eating outside of this. So it's being rediscovered now, but I'm certainly not, I didn't figure this out myself. I mean, I sort of came to this independently, but then when I started looking, I found that this is a tried and true, time-tested hypothesis that when put into practice, people see quite a lot of results. And I think there is enough evidence when you look at the totality of evidence from biological, physiological point of view, that you can make this theory that, okay, well, maybe this will help people. It's not going to hurt you. There's nothing unsafe in eating meat. We know that we can get all our nutrients from it because people have been living in the Arctic Circle during the ice ages, or alive right now in the Arctic Circle and predominantly eating meat. So we know we can survive and thrive, because if you're not thriving in the Arctic Circle during an ice age, you're not living. You have to be very successful.
Well, so I look forward to a book or any kind of thing that puts all of that history together. But let's now go to the current day, where the old and the new clash, and people go get their blood work. Oh my goodness, I learned this 25 years ago, that the ketones go up in the blood on a keto diet, and it's marked abnormal because people who eat carbs don't have ketones, and the lab work is from people who eat carbs. So, okay, ketones, that's fine. Well, and then, Sean Baker has an elevated hemoglobin A1C, and some people don't have perfect, pristine glucose levels. And now a prominent influencer did a ferritin level, and it was really high, and got concerned and stopped doing so what about the long-term implications? And the clash of the blood work doesn't look all that good all the time.
Well, you have to take sort of individual cases as individuals. I'm sure in your practice, you've actually seen the totality move in the right direction, as has I. So I have, really at least hundreds of patients that I've put on a carnivore diet over the years. And my predecessor, the reason I sort of transitioned from neurosurgery into the metabolic health space is because My friend who had this metabolic health practice, and he was there for 34 years, he was sort of forced into retirement, and basically you would have to just shut down the practice, and these patients wouldn't have anybody to see unless I sort of stepped in and took it over. So I decided to do that because I didn't want to leave the patients hanging. And so he's been applying carnivore diets, because of our relationship and me talking to him for about 5 years now. So he's had hundreds and hundreds of people over the past 5 years. I've been involved, or, a day or two here and there, and then full time for the last year and a half, 2 years, and probably 2 years at this point. And so, we meticulously track bloods. And so I see them, I'll see patients, and I'll do a full set of blood work, metabolic, hormonal, different sorts of panels, and whatever, relevant to that patient. And I'll talk to them about how their diet and lifestyle affects this, and how carbohydrates, this is raising your insulin up to here, and this is what's causing these problems over there. And so we say, okay, well, put this diet and lifestyle changes into play, and then we'll see your bloods in a few months, 2-3 months. And if you do that, you should see this go up and this go down and this to this. And almost invariably, this is exactly what you see. You see these changes in those directions. I mean, I've had patients that, did not have a genetic hemochromatosis, but still had to donate blood every 2 months because their ferritin would just go sky high, go onto a carnivore diet, and all of a sudden it came down to an ideal level. And so was that going to happen for everybody? I can't say that it will, but it did for these patients. I actually literally had one today. We actually looked at their ferritin levels again today. And
I would be interested in ferritin level. To me, doesn't really matter. Are they really accumulating in the liver? And that would be a great case study. By the way, the Journal of Metabolic Health takes case studies. I'm on the editorial board. The editors are in New Zealand. Yeah, so ferritin was one thing, hemoglobin A1C is another. Vitamin C, I ask these questions with the knowledge that I've been using this in a practice now for 20 years, and I'm not worried about it. It's just other people are, right? So how do you handle the vitamin C thing? And we can't go back to the Maasai and the Inuit, and that only goes so far. My colleagues, your medical colleagues aren't going to take that. And there's a case, I think one case of scurvy from someone who was up in Appalachia. No one really knew what he was doing, but every time he came down out of the mountains, he had scurvy, and he said he was doing a carnivore diet. So that's not really a credible case. So, and then Steve Finney, one of my teachers, says, we handle vitamin C differently with different ways of eating, and we need less. So there's conditional essentiality even. How do you respond to, well, you're going to get scurvy?
Well, you absorb different amounts of vitamin C depending on what you're eating. So if you're eating carbohydrates, you compete for uptake in the gut with vitamin C with a GLUT4 receptor. So if you have an abundance of carbohydrates in your gut, you are going to crowd out the vitamin C. So you only need about 10 milligrams of vitamin C if you're eating carbohydrates in order to stave off scurvy. That's what the recommendations are. But if you're not eating carbohydrates, you need far less than that. Now let's think about what is scurvy. Scurvy is a misfolding of collagen molecules, because if you don't hydrolyze proline and lysine, they won't bind together properly. And so you'll get sort of loose connective tissue, and it'll get you'll get damaged vessels, you'll start bleeding, you can die. It's very serious. But if you're eating meat, you actually get an abundance of hydrolyzed proline and lysine. You don't need vitamin C to catalyze a reaction to hydrolyze those molecules. So, I remember, it was actually funny. I remember thinking this when I just eschewed plants initially. I remember every few months I was like, should I take a multivitamin? Do I need to eat a banana or something? And I remember thinking to myself, well, I feel good. My gums aren't bleeding. So let's ride this out and see what happens. Now I know the biochemistry behind it and why I didn't get sick. But, at the end of the day, we can have different sorts of theories on what would or should happen. But what happens? What does happen when people do this on a day-to-day basis? No one gets scurvy. I mean, this isn't something that happens. And we can understand why. Mechanistically, we shouldn't get scurvy if we're eating enough meat. I looked into the history of it as well. You know, the British limeys, when they started having lime juice in order to stave off scurvy, it was actually just the sailors in front of the mast, so the not the officers that were getting scurvy. They ate a very different diet. The officers weren't getting scurvy. They had a ration of meat. The reason they're called limeys is because that was a pejorative from the other European powers who thought that the British were crazy to eat limes and lime juice because, oh, you get scurvy, you get sick. Like, none of them were getting sick. And so they were like, okay, limey, you know, that's what they were calling it. It was an insult because they thought they were being silly. And so, you know, this is what we, you know, but this catches on. And I mean, I think it's similar to the oh, you should eat carrots because it's good for your night vision. Well, that was propaganda from World War II fighter pilots because we had radar technology and we didn't want Hitler to know about it. And so we put this press release out that our fighter pilots are the best because they eat a bunch of carrots, and so they can see super far and see these planes before they get seen. So these things get stuck in our diction, and we don't really know what they come from, but when you look into it a bit more, it's interesting. But yeah, I mean, that's sort of the mechanism behind it, you know. And conditionally, like to your point, you know, vegans will say, well, you get all your proteins from meat or from plants and things like that, which is not true conditionally, because we say that carnitine is a non-essential amino acid, but that's only true for about 70% of the population. About 30% of the population don't make a sufficient amount of carnitine. Some don't make any at all. And so for them, it is conditionally required. They absolutely can't just subsist only on a vegetarian vegan diet. And so, you know, if that's a third of the population of Earth, you know, so that's a serious thing to think about. Taurine, you know, we make that in our liver, it's expelled in our bile, and fiber binds to bile. And so that you eliminate your bile, you can also pull the taurine out with it. And so even though we make taurine, you may be deficient in taurine depending on what you eat, or if you're on one of these medications that draws out your bile as well. So, you know, I think we need to think of this not just of, oh, are you getting anything from a carnivore diet, which historically we always have, but what about this other way of eating? What about the anti-nutrients in plants that actually block out the absorption of the different vitamins and minerals as well? I think everything is fair game to look at.
Well, thank you so much for talking. I'm going to be respectful of time, and I'm certainly, I would say, very, very impressed. I know, you know, coming from the background that you have, knowing that the things you've done are almost, this is, I guess, a caveat. The things you've done you're kind of superhuman in doing the sports, and then the neurosurgery, the endurance, the deep dives, and literature reviews. You're like checking off all the boxes of me, you know, as a critic, saying, you know, you're spot on. I'll put up. I look forward to a book or other things that come. Even a case series of a practice would advance the science in this regard. Great to meet you. And so, where do people find you? How can we promote what you're doing now?
Well, thank you very much. It was a pleasure to come on. I've really enjoyed your videos, and my fiance actually loves your videos too. She really liked your presentation style and just how knowledgeable you are. But you know, she's coming from a layman's perspective. She doesn't know the jargon. She really likes how you present that. So thank you for everything that you do. I have a YouTube channel myself. It's just my name. It can be found under my name, Anthony Chaffee, and I have a podcast that's sort of a silly name, but it catches the attention. It's called The Plant Free MD, and so that's available sort of wherever people want to go to podcasts. And then I think I'm most active on things like Instagram. Again, that's just my name, Anthony Chaffee MD, and Twitter's Anthony_Chaffee. So that's where I'm most active. And I try to you know, involve myself in the community and interact with people in the comments and answer messages as much as I can, and just try to help people. All my material is available for free. I don't do anything behind a paywall because that's not why I'm doing this. I have a job. I like my job. I enjoy that, and this is really just to try to get this information out there, because I see how much it helps people. And I think that this is a human right, and we deserve to have our birthright of good health. And so I just want to get that out there to as many people as possible. And hopefully have a book forthcoming sometime this year.
Great. Oh, this year? Fantastic. Well, Dr. Anthony Chaffee,
Next year. Yeah.
thank you again.
Yeah.
Take care. Thank you.
You too.
If you enjoyed this video, be sure to like, subscribe, and hit the notification bell, and check out adaptyourlifeacademy.com.